My name's Theron. I'm a student physical therapist assistant. I'll be helping you out today. Can I just get you to confirm your first and last name for me?
Tucker Usher.
Awesome, thank you. All right, so I see in here that we're having a little bit of low back pain. I was reading your chart here that it's about L405, kind of lower in that back.
Yeah, I think I remember what they were telling me.
Yeah. And then how would you rate your pain on a scale of 0 to 10?
I'd say when my pain really exacerbates, it can get up to like a 6 out of 10.
Yeah, is there any specific things that make that worse?
If I'm doing a lot of like forward bending, I really deadlift a lot.
Okay.
So just anything where I feel like it's anything where I'm flexing my back like forwards.
Yeah. And is there anything that makes it better or kind of helps resolve some of that pain?
When I'm laying just flat in bed.
Okay.
Yeah.
Okay.
Pain goes down to and you can get down to like a 2.
Down to a 2?
Yeah.
Okay.
It's still like kind of there, but when I'm laying flat, it goes away for sure.
Okay. Yeah, so ideally what we're going to do today, we're going to do some traction, ideally kind of help to lower some of those pain levels. Have you ever done traction before?
No.
Okay, so this will be our first time. We'll kind of introduce the traction, but basically what we're going to be doing is I have this special table here that slides. I'll put some of these belts around your body, and then I have a machine here that's going to pull your body. It's going to decompress the spine a little bit. We'll kind of put some space in between those vertebrae, ideally relieve some of that pain, and hopefully get you feeling a little bit better. But before we do that, I do just have a list of things that I have to ask to make sure that this is a safe treatment for you. So just let me know yes or no for any of these. I'll be making sure to stay away from any motions that are contraindicated for your condition here. One thing I want you to let me know is if you have any changes in the pain. So if you feel like that gets any worse or goes to any other parts of your body, or if it completely goes away, just let me know, and we can take an eye and adjust that if we need to.
Okay.
Do you have any acute injuries or inflammation? Anything recent?
No.
Good. Any joint hypermobility?
No.
Good. Any uncontrolled hypertension or high blood pressure?
No.
Okay. Good. Do you have any structural diseases that you know of?
No.
Any displaced annular fragments?
No.
Or medial disc protrusions?
No.
Good. Yeah, let me know if that pain goes away completely. That's something we want to keep an eye on.
Okay.
Do you have any problem laying on your back or on your stomach?
No.
Okay. Do you have claustrophobia?
No.
Good. And do you feel any sort of disorientation today?
No.
Good. As I said, I will be putting these belts on you, so I'll make sure to keep those belts in a safe place and make sure that the pressure is good. I'll check in with you throughout and let you know. And so we'll be putting you, hooking you up to these tables. There'll be a little hands-on. It might be a little bit of pressure, things like that. But do you have your consent to go through all of those motions?
Yeah.
Okay, good. Perfect. All right, so yeah, let's give this a try. So what I'll have you do is just lie down on the table with your head down on the pillow here, and we'll get you strapped into these belts. Good, just want to make sure this is locked. Perfect. So I went ahead and put these down here beforehand. So these are going to strap across your chest here. All I want you to do here is take a deep breath in and then breathe all the way out. Breathe out as hard as you can. Exhale all the way in. Breathe out, breathe out, breathe out. Good. Should be nice and snug. Does that feel okay?
Yeah.
Good. All right. And we're going to do that one more time. Here, breathe in all the way out. Good. Good. How's that feel?
Good.
Good. All right. Can you do a little bridge for me? Perfect. Relax right there. Let me get hooked in. This is just going to be extra little secure. So this lower end here is what's going to attach to the machine.
Okay.
It's going to pull your lower body. So I'll pull down on your hips. Let me know if you feel any sliding or if that feels uncomfortable or causes any pain, okay?
Okay.
This loops right here. Perfect. All right. Get this turned on for you here. I'm gonna raise this table just a little bit. All right. set this up, since this is our first time, we're just gonna have this pull at a consistent 30 pounds here.
Okay.
As we go through this, if this is something that's going to be helpful and beneficial for you, we'll adjust those times.
Okay.
But it'll have 1 minute that it'll take to pull you out.
Okay.
Then it'll hold that same pull for about 8 minutes, and then it'll slowly ease you off.
Okay.
If at any point in time you have any changes in your pain, you feel it go to a different part of your body, or it goes away completely, you press that button, that'll stop that, that'll let me know to come over and grab you.
Okay.
And we'll let you know. I'm gonna go ahead and unlock this table here. That'll allow it to slide. And then I'm gonna get this started. Okay, I'll stay with you for this first minute while it builds up. And you should just feel a slow pull.
Okay.
I'll just keep an eye on this for you while it's going through. You feel a little bit of pressure. You feel that starting to go?
Yeah.
Okay. Perfect. While that's building up, I'm just gonna grab this here as well. I'm also gonna just leave this bell if you need anything that doesn't necessarily need to stop the machine, okay?
Okay.
I'll just set this by your side here.
Okay.
You can just ding that anytime, okay?
Okay.
Good, we'll let this build up. Perfect, okay, so that should be about full pull. How does that feel?
Good.
Good,
Yeah.
okay, so that'll be for about 8 minutes. It's just gonna hold you here, so just go ahead and relax. I'll come back for you in just a little bit and check on you, okay?
Okay.
All right, how are we doing?
Good.
Good. This is just ending this last little bit here. Just gonna go ahead and get that done. And this should slowly release you out, okay? It's been slowly doing that for the last little bit. This is just the last little bit of relief here. Yeah,
Feel it.
good. No changes in pain or anything?
No.
Good. All right, and then we'll get you all unhooked here once this comes out. From here, take your button. I'm gonna go ahead and lock this back up. All right. Get out of here. Just got a couple more questions for you before we finish up.
Okay.
So for this one, let me lower you down. I'm gonna help you sit up here. Since we put a little bit of space in the spine here, it might, be a little, stretched out. So we're gonna slowly, I'm gonna help you with a log roll. So I'll have you bring your arms in. You're gonna reach this arm across here. We're gonna roll as one piece. Bend your legs up for me. Good. We're gonna roll to our side first. Roll towards me. Good. And then I'm gonna help you sit up. You're gonna push off this hand. Okay, ready? 1, 2, 3. Sit straight up. Good. And we're gonna sit here for a minute, okay?
Okay.
So this is just kind of getting you readjusted to gravity. So we put a little bit of space in there. It's called the rebound effect, where we put some space in there. So now gravity is going to kind of push back down into that a little bit.
Okay.
So let me know if you have any changes throughout the rest of your day here as well.
Okay.
But just make sure that after we're doing these sessions that you're sitting for a minute before we get you standing back up.
Okay.
And we'll just keep an eye on you there. After we pulled you for a little bit, do you feel any changes in your pain levels?
I definitely did when we were doing it. I felt like I had a decrease in pain, yeah.
Yeah.
I'd say it was like a 3 out
Okay.
of 10.
Good.
Same as right now.
Yeah.
Feels
so it's
good.
feeling like a 3.
Feels good right now.
Okay.
Yeah.
Good. So yeah, we'll kind of progress this as we go through. We'll kind of start pulling in different weights and kind of just going through that just to kind of get those pain levels down. And we'll keep working on it. Do you have any questions about the procedure or anything for me?
I don't think so. No.
All right, then you're all set.
Thank you.
Have a great day.